back to Lara All in All. Today we have an interesting topic. Thank you so much, our old time subscribers. Thank you for the new ones that is coming. God bless every one of you in Jesus' name. Today we have an interesting topic which is fibroid. Over the years, over the months, we've just seen people, suffering of this fibroid. Is there remedy? What's the cause? Is there healing? Is there treatment? Can it lead to miscarriages? Can it damage uterus? Can it just make you look smaller? Can it make you look tinier? We've had a lot of questions. So we are going to talk about common of the symptoms that you see when you have fibroid. Most women vary. So we may have some and the other women might have the other symptoms. But generally, just capture yourself over the symptoms and know what you have. So the signs of symptom is the urine fibroid includes heavy menstrual bleeding. Some people, you have your menstruation, your menses, your menstruation, your periods, 3 to 4 days, but it's bleeding as if no man's business. You need to go for checkup and know what is really wrong when you have excess bleeding. And maybe your menstrual period, instead of 3 days or 4 days that it not lasts a week or over a week. These are the symptoms. The first one is you have heavy bleeding. Second one is your flow stops like 1 week plus. You need to just check. And your pelvic pressure or pain. Now the pelvic, there is a pain there and you are wondering what is strong, okay? So you need to go to a checkup in all this for you to know. It's a common symptom, but I'm not just concluding that it's fibroid, so that is why you must go and do checkup. And it said frequent urination. You go to toilet, you just pee now. After 10 minutes you've gone there, after 10 minutes you've gone there. It's only in pregnancy that when the due date is coming, you see women urinating. But in this, you are not pregnant, you just see that you are urinating a lot. Difficulty in empty the bladder. You just go there. Sometimes it's difficult for you to even pee because it's so painful, and you just stand there, you are just screaming, God help me, God help me. So these are the symptoms of fibroid rather, and you know what you do. Sometimes you just have leg pain. You have the backache, sometimes your back is just paining you, your leg, there is pain and the pain is not going, and you have the constipation. You are not just comfortable. Whenever you eat, it's like you want to throw up. You are not just comfortable. These are some of the signs that you must know that there is fibroid or symptoms. So having said that, it's not that because these symptoms are coming, you are not pregnant, so that means that you are just doing anything that you need to do. Okay, so there is overview. Urinary fibroids are not cancerous, okay? Growth of the uterus that just appear during childbearing or years after you have just given birth. You can see this is a fibroid location underneath near the uterus, where the womb is and where the baby is coming out from. So that is where you can find fibroid. So it's not that you find fibroid in your face or anything that you say, okay, this one has come. So sometimes it's just like in the urinary system. That is where you see it. That's we are talking about the urinary fibroid. You can have uterus fibroid. Then urine fibroid has been associated also increase the risk of urine cancer. Be careful. And almost never develop into cancer. So 95% of it might not be cancer, but 5% might just contact it to be a cancer. But you need to be very careful to know what to do. Okay, fibroids are rare in size from seedlings, very tiny ones, and undetected by human eyes except to go to the machine, or bugging masses that can dissolve and enlarge in the uterus. So that's why sometimes most women are difficult for them to give birth, because it's around it, and if it gets to uterus, you can never just give birth because a baby will not stay there. So that's the essence of checking up. At least for the women, go and do checkup 2 years. Now they do the cervix and the uterus. We just do the checkup every 2 years. It's not expensive. As a woman, go for your breast, just check. Go for everything about you, go and check. For as men as well, I think, but the women mostly are also fine in all this. You can have also a single fibroid or multiple ones. You can have big ones, smaller ones, medium sizes, but it can also be expanded to each of the sizes when you don't take care of yourself or they don't detect it on time. Many women have uterine fibroid. Sometimes during their lives, they might not know. Sometimes when they want to give birth to children, they now understand they have fibroid. It has been a blockage and all that. So many people have done fibroid and they cannot give birth to children. So it's not a criteria that you do fibroid because of that child is not coming. So be very careful as a woman. Just go for checkup and understand what you need to do. Now, when it comes to that heavy flow, as you go and see the doctor, he knows what to do and he knows how to treat you. So be very careful and make sure you go and see the doctor. So when are you going to see a doctor? See your doctor if you have pelvic pain that doesn't go away. See the doctor if over bleeding. I've said it before. See the doctor if you are spotting a bleeding between period. It's not coming, there is no blood, but it just come, let you and go. Be very careful and just know what you're doing and you seek help. Even as God is healing, seek medical help to help you. Even the herbal tips, seek everyone. But make sure you go for regular checkup as a woman that will help you out. God bless everyone. Thank you so much for this wonderful episode that you are listening. Please share us, like, and comment on our session. If you have any topic you want us to treat, just put it on the comment section. I will be glad to do that. God bless you. I am Pastor Laura, or I am Loretta from Laura All in All. So God bless you and have a wonderful day. Bye-bye.